The mission for Fight Colorectal Cancer is we demand a cure for both colon and rectal cancer. We support and educate patients. In addition to that, we push for changes in policy that will both increase and improve research for colorectal cancer. And we really try and empower survivors to raise their voices against the status quo. I joined Fight Colorectal Cancer because it's a patient advocacy organization that's really here to help patients and caregivers and family members and friends of those who have colorectal cancer. My father was diagnosed with colorectal cancer in '97 and unfortunately passed away from the disease in 2005. And I know a lot about the disease state of colorectal cancer, as do our answer line associates who answer the 1-800 number. And I really wanted to work together with patients and let them know that they're not alone in their fight against colorectal cancer, that we're here to help them with their symptoms, with their side effects, with their treatment choices, as well as perhaps helping them find clinical trials that they might be eligible for. One of the things that we want to do at Fight Colorectal Cancer is make our materials available to patients in whatever way that they want to view them. And within our patient education and awareness program, we do outreach to patients in 4 different ways. We have an answer line. It's a 1-800 number that patients and caregivers can call into to ask any questions they have about their disease or their diagnosis. We also do monthly patient webinars that are free to patients and caregivers that talk about things like decision making for stage 2 colorectal cancer patients, and highlights from meetings like the Oncology Nursing Society meeting or the American Society of Clinical Oncology meetings. In addition to that, we have a website that has about 1,000 pages of patient information on there. And then in addition to that, we have a quarterly and monthly newsletter that goes out to patients and caregivers, anybody related to the disease of colorectal cancer. So one of the things that our policy arm of the organization does is work together to push pieces of legislation that would, if passed, create a national colorectal cancer screening program. And what we would encourage patients to do, if you're over 50, it's important to get screened. The disease, colorectal cancer, is both preventable, treatable, and beatable. And it's important that if you're 50 and you're not symptomatic, that you be screened then. And if you are symptomatic prior to the age of 50, and or if you have some family history of colorectal cancer, it's important to be screened at the time that your symptoms present themselves. A success story that I could share with you is we had a patient, a stage 3 colorectal cancer patient, call into our answer line, was referred to our organization by her nurse, and called into the Fight Colorectal Cancer answer line just to ask some general questions about her disease, question about what her treatment options might be. And through coming to our organization through the Fight Colorectal Cancer answer line, she's become an advocate of ours. Not all patients, when they're diagnosed with colorectal cancer, view themselves as advocates, and that's what we try and do for patients. We try and empower them, like I said, to raise their voice against the status quo and to become advocates for themselves. And she now, unfortunately, is a stage 4 colorectal cancer patient, but is an advocate not only for herself, but also for Fight Colorectal Cancer. So patients and caregivers can get a hold of us in a couple of different ways. They can go online to our website at fightcolorectalcancer.org, and there's a For Patients section there, and they can click on that and actually send us an email if that's easiest for them. Or they can pick up the phone and call us. We have an answer line, the Fight Colorectal Cancer answer line, that's staffed Monday through Friday with Fight Colorectal Cancer answer line associates that are there to answer their questions. And they can reach us by calling 1-877-427-2111. And that line is manned Monday through Friday from 9 a.m. to 5 p.m.